So hi to everybody out there, all of you cat lovers, cat respecters, wherever you fit on that spectrum of working with feline patients and clients, we're glad you're here. Tonight is sort of a culmination webinar of sorts. We're really excited to showcase some of the content you may have missed throughout the year, but I'm a big list person. And for me, I think it's really helpful, especially, you know, you may be in a very different stage, everybody listening, of your feline friendly improvements at your practice and what you're doing to elevate the standard of care for not only your patients, but your clients and also your veterinary team. So tonight are going to be sort of my list, as well as from some of my colleagues and expert KOLs, sort of our must-haves for every feline practitioner, whether you're at a cat-only practice or you're the sole cat lover at your mixed general practice for small animals. And of course, we're talking about the other species, right? But these are the must-haves. And so we'll go through some examples and certainly give you a lot of the why behind that, as well as, like Matt said, leave the floor open to questions. So please throw them in the chat. We want this to be super practical and very helpful and actionable for you so that you've got some things to take away, maybe grab on Amazon or put on your wish list as you look forward to 2024. So as we reflect back on really where we started with feline medicine, with full body restraint and, you know, dare I say the S word, right, scruffing, we've really come a long way. But it's not just in the understanding of basic cat body language, but also about restraint techniques and choice and control, the big 2 C's. We did a whole webinar on that earlier this year. And the strategies of all types that we use to reduce stress and anxiety. And this is not only important for increasing the number of cat visits and our cat caregiver compliance, but much more important in the preservation of the emotional health of cats. And as we, you know, kind of go through these and think about other things that we've learned that waiting until we see this, right? I'm so sorry. The highest escalation of anxiety, which is manifested as hissing and batting and this reactive behavior. We know that we, along the way, have missed subtle signs and opportunities to pause, to approach this cat with a different plan, or even in some cases, as we know, postpone the exam or the procedure until another day where we have pre-visit pharmaceuticals or another sedation plan on board. Because these fearful moments that we see become stored memories permanently in the amygdala of these cats, and they never go away. And that's one incredibly strong reason that cats fear veterinary hospitals and veterinary team members. So we're all here tonight and in this program, and certainly so many other colleagues around the country, to elevate not only the physical, but also the emotional care of our feline patients and our cat caregivers. So I hope together we can take an oath, would be great, but at least a silent moment of solidarity here on this webinar, that these moments are going to end. We don't want to scruff anymore. We don't want to do full body restraint. We're not going to force these patients into restraint that provides no escape, no ability for choice and control. And through these escalating body postures of stress, we're going to hopefully be able to more subtly recognize these and start to adapt and be flexible and change these positions so that we can, again, make sure we're moving towards that right direction of that elevated care. 2024, just around the corner. It's time for some new beginnings in our hospitals when it comes to our feline families and also our veterinary team. Because guess what? These must-haves that we're going to go through tonight don't just benefit our patients and their cat caregivers. We know from many studies out there that strongly bonded cats and cat caregivers seek out more preventive care. If you look at the most recent HABRI research, it absolutely points to this. Happier clients are more compliant. Happier clients give us less transfer of the caregiver burden, because that's what creates a lot of our compassion fatigue. Happier clients support a happier work culture for us, for our teams, and certainly when we go home from work and bring everything home with us, it creates just for a happier lifestyle when we leave practice. So let's go through our perfect 10 must-haves and sort of a preview of what we're going to be talking about tonight. I'm going to try to go through these in sort of a cat journey of sorts. So starting at home and sort of working our way through admission and through the exam process and diagnostics, and then also just how we communicate with these clients after they leave our hospitals, how we keep them bonded to us. But I think before we get started going into deep, I'd love to turn the floor back over to Matt and kind of get a sense of everyone of how they're doing before these cats reach their hospitals.
Yeah, we're going to do some polls and some quizzes or some polling as we go throughout the night. So I'll pop this poll up on your screen here in a second. Dr. Marks, I just wanted to let you know I went through the chat. We asked everybody to check in where they're from, and I counted 24 different states checking in so far tonight of the people that responded. So anybody else out there that wants to let us know where you're from, please do. All right, let me launch this first poll question. Let's get it up there. There, everybody seeing that? Question number 1, do you have a specific guide, handout, or link on cat carrier training? Yes or no? Do you have something that you guys hand out? And Dr. Marks, while everybody's answering, do you really need to have something to take home? Is it not enough to just talk to your clients about cat carrier training in practice?
Well, when I started in practice, I thought that just me verbalizing it was plenty. But we know that as people leave our exam rooms, they forget over 80, sometimes in some polls, it's been over 90% of the information that we verbally talk about. The other thing is as practitioners, as all of you know, we have so much to go over in these exams, especially in new kitten exams. And often what we do is we fall back on these easy assumptions. Oh, you had a cat before, you must know about cat carrier training. And we just very quickly skip over it. I have been burned so many times by clients that I considered my best feline cat caregivers who still were struggling to shove the cat into the carrier after they chased it out of the bed from under the bed with a broom, or shaking the cat out of the carrier when it comes into the exam room. Completely unintentional, right? But just not understanding the true value of cat carrier training. So I want to make sure everybody is on the same page. Every cat caregiver needs not only the vocal description of that from the exam room, but either a guide, a pamphlet, a handout, a link on a website, a follow-up email. Cat carrier training is a must. I'd love to hear if everyone's on board or if we have differing opinions on this.
Actually, we need to do some catching up because 82% of the respondents are saying no, they do not have a handout that they give out.
All right. So again, you're right where I was. And this is really interesting to see because I think that represents the majority of the opinion of colleagues around the country today. So as we think about this is what I want you to, again, to remember. The feline exam does not start in our hospitals. The feline exam starts at home. And unless we have the ability to have cats be desensitized to cat carriers and actually choose the cat carrier, we end up, unfortunately, with the cat not only not liking the cat carrier, but the cat caregiver or parent getting so stressed out by the process that they start to shy away from care. We know that to create the lowest stress environment, these cats have to start with stress reduction, again, in the home. We also know that for everyone involved in the veterinary client-patient relationship, everyone involved needs to have the lowest stress possible for for compliance and also for acceptance of new information. So if we have a cat that's relaxed, but a cat caregiver who's on edge, right, and anxious, they aren't going to receive the information that we're trying to deliver to them. So my favorite cat carrier training handout is actually this one through AAFP. I am happy to send this deck to anybody who wants this afterwards. My email will be at the end of this presentation. So shoot me a quick email and you'll be able to get this. It's a really nice, they also have a color printout if you want to do that, but they have a digital piece, right? So this could be something where you need to be able to either hand out in person, or if you're completely digital, this is something that gets sent to your client as a follow-up, or gets sent out in a pre-visit questionnaire to your cat caregiver before they come, or as soon as someone schedules an appointment, maybe this is in the confirmation email. However your practice wants to do this workflow, but it's really critical that they understand the ways that we can make safe travel, but also safe experience at home. The problem that we run into is so many of our cat caregivers and just clients in general are seeking out sources on Dr. Google that maybe aren't necessarily the ones that we agree with. So let's be proactive and give them the sources that we want them to read. I, again, have made so many mistakes in practice with assumptions. So even those clients, I can't stress this enough, even clients that have had cats for decades, this is newer information, and stress that, right? We know more about how cats respond and how this is one of the biggest stressors. Use this on your social media, use it on your website, put it in your kitten kits, your emails, your texts. There's so many ways that we can make sure that we provide, again, this information. And then what are we trying to tell them, right? The tips that have to be there is the carrier needs to stay open. It needs to be a chosen safe space for those cats at home. Preferably, the bedding should be fleece. That is the preferred texture for cats. We want to make sure that these cats are fed high reward treats and or their food in the carrier. And again, without the door being closed. This carrier should be part of the furniture. It should be out permanently in a very visible and social spot for these cats, not hidden, next to the laundry machine or behind a toilet, be out of sight. It needs to be visible. It needs to be, again, something where we're using relaxation techniques and also positive rewards and association. And then certainly if you can use either a diffuser or a synthetic feline pheromone spray on the fleece bedding and around that carrier, this will also help to relax these cats and make this a chosen space that they want to be. The other thing that I want to talk about with a cat carrier, that's an essential piece we often forget about, is actually the recommendation of how to carry the carrier itself. So instead of carrying this cat carrier by the handle, as you see on the left, the ideal strategy is actually to put your arms outstretched, put the carrier, of course, there, a pheromone impregnated towel over, covering 3 sides, and to carry it this way. Not only is that going to limit the motion sickness that we often see from carrying it all by the handle, but it also allows the cats to be in more of a vertical space. That's what they choose and want to be in, so that they're not at nose level for every curious dog they're going to encounter, or, a very curious toddler that starts poking, and certainly all of the other sights and sounds that are going to happen on the way to your animal hospital. So definitely thing to remember. We have to be the stewards of being role models, right, for this. And so a lot of times, even to get you in the habit, we'll often duct tape the handle down to force us to carry from underneath. And that can, of course, be temporary. But as important as the initial training is, it's also our responsibility to help with what I call the peaceful return, right? Because if it's great coming, but as soon as those cats get home, they're very vocal in the car, and the cats at home do not accept these cats back into the home, that can be a stressor that's the last thing that caregiver remembers. So when the patients are with us in our hospital, even if it's just for an exam, but certainly for those that have procedural work, surgeries, dentistry, are hospitalized, they start to be exposed to unfamiliar materials and unfamiliar odors. And remember, anesthesia byproducts linger with cats no matter what you use. I'm talking gas anesthetics for 24 to 48 hours. That can be detected by other cats in the home. So help create that peaceful, lasting, positive impression with these families by encouraging them to bring something that smells like home to place in the carrier. And then, of course, pheromones in the carrier and in the house, we can do our part, of course, by getting that carrier ready to go home. And then allow that time at home for interaction between cats. Some of these cats, especially if they have a history of difficult interaction and re-entry, these cats that are coming home can be placed into a room by themselves, let the resident cats in the multi-cat home be able to sniff under the door, and let that be a very gradual reintroduction. It's unfortunately much harder once there's been a quick introduction and multi-cat conflict to take them apart and reintroduce than to do a slow reintroduction from the beginning. Now, speaking of relaxation, cat carrier training is obviously the foundational start of that low stress visit, but many patients need pharmaceutical assistance, right, to relieve anxiety. So number 2 must have as a feline focused veterinary professional, of course, is an anxiolytic protocol that your hospital likes. Now, I'd be surprised to hear of any veterinary team or anyone on this webinar tonight that hasn't heard of gabapentin or has used this in your feline patients. We know it has a great safety profile. It can be used in almost all of our patients. It provides sedation, analgesia, it's anxiolytic, all in one, right? It's sort of a multi-combination therapy. And it's economically feasible for most of our families to use. In fact, we know that we can prescribe also a loading dose the evening before, which is approximately 100 milligrams, right, for a healthy adult 10-pound cat, and also in the morning, and they act synergistically for that maximum efficacy. However, I want to share what's new. There's new research that has really shown a lot of promise. And this study, they're looking at this molecule, pregabalin, which you may have already heard of course, but it's a more potent enabling molecule that has a similar efficacy to gabapentin, but with a much smaller dose without the need of a loading dose. It has faster absorption and more favorable pharmacokinetic properties. So I'm really excited. This brand new journal article that came out of Animals in 2023 showed this information. And I really want to share this with you because it's very, very exciting of what's to come. The anxiolytic properties of this novel pregabalin oral solution were started with, they were measured at a dose of 5 mg per kg and found to be statistically significant and clinically relevant in cats with acute anxiety and fear that was associated with the transportation to veterinary visits and also with the visit itself. The nice thing about this is that, as you see highlighted here, the anxious cats were almost 4 times, so 3.8 times more likely to remain calm and quiet during transport using pregabalin as compared to the placebo, and the veterinarians who are performing the exams were 3.4 times more likely to easily perform a physical after use of this compared to the placebo. So the really nice thing about this is not only is this, again, a single dose, we have proof, right, statistical significance in this study that we're able to see not only calm transport, but also a calm exam. And this is without a significant sedative effect. The owners that were part of this clinical study found that with that smaller dosing volume, it was much easier to administer. So this is a really exciting option that is coming very, very soon. So be on the lookout for some very important news to come. For other cats, in-hospital sedation may be necessary, and early intervention with these patients is preferred. There's 2 great resources I want to share with you. One, if you're not already in this or familiar, is the Veterinary Anesthesia and Analgesia Support Group, or VASG.org. It has everything on here, with everything anesthesia, including, which I always found somewhat challenging, a very easy CRI calculator. The other part of this that I want to point out to you is catvets.com. And these are 2 really great tables to laminate and keep in your treatment areas and your surgical suites, and any protocol handbooks or quick references for your team that give you exactly what you need for IM injection, or certainly IV or cocktail, as well as any specific side effect to be watching out for, not only for your team, but also for your cat clients themselves. Now, the third needed must-have for every feline practitioner and professional out there, of course, is pheromone therapy. I think for many of us, it used to be thought of as, all right, I'll try pheromones, or this might work. You could add it in sort of as an afterthought. And typically it was in these very advanced stages of behavioral disease where we'd sort of just throw it out there like a Hail Mary. But the good news is that pheromone therapy is now considered to be a very proactive and even supporting tool in the prevention. Cats are very complicated and complex in some ways. They're phenomenal creatures. But certainly when we start talking about pheromones, I think one area that a lot of people are not familiar with is that there are actually 3 areas of pheromone release in cats. The first are the harmony messages, and these come from the mammary areas. They act as appeasing pheromones similar to dogs to create harmony of cats within the home. There also are happy messages that are sent from the facial area. These are the facial pheromones, I think the ones that most people are familiar with. And they're responsible for territory marking and creating that message of comfort in the immediate environment. But we also can't forget about the territory pheromones. And these are the interdigital pheromones released from the foot pads. These are responsible also for territory, but of course for inducing scratching behavior. So when we think about pheromone therapy, again, I want you to think not reactively, but proactively. Consider the benefits for not only in your hospital, but also at home. Feel-away spray and towels really should go together like peanut butter and jelly, because there are really some keys to success that I find. And often the most common questions are, how much do I use, where, and when? So remember, when you're spraying items like towels for use in the exam room or for recovery or hospitalized patients, even for over carriers and cat condos, the recommendation is to do 8 pumps every 5 hours on these items. So we want to make sure that we're doing this in sort of a checklist. Make sure you have some sort of very small and easy to follow SOP, so that the cat's not already in the room and you're going, oh, forgot the towel, and they're spraying it right there, because that's not going to have the efficacy we want. But you can do it, of course, in lots of different places. And remember, while the organic surfaces are going to absorb it most, you certainly can also spray carriers and kennels themselves. Now, one question that a lot of people ask, and I think it's not until just somewhat recently that we've been able to really look at this, is how long do I need for pheromones to actually work? I don't have a lot of time. My appointments are super short. My clients are running behind. I'm by myself, right? But a study that came out of the Journal of Feline Medicine and Surgery found this, I think, kind of a comforting statistic, I think, for me. And that's, if we have 15 minutes of contact time, that's enough to produce changes in the behaviors of cats. So if you think about that, think of your workflow, think of how your appointments go, think of what you've got going on that day. We need 15 minutes. And what I did at our hospital is we had 3 times during the day that we created these towels. So it was when we opened, at lunchtime, which was 5 hours later, and then we had an evening kind of spray, and those towels were set, right? So if we can think about that and think about, again, how your hospital works, it's easy to create a little bit of a, again, working protocol so that these things sort of don't slip through the cracks, which is obviously very easy to do. The other aspect of pheromone therapy that's a must-have for hospitals and homes as well, of course, is diffuser therapy. Now remember, one diffuser covers approximately 400 square feet. They do need monthly refills. It is important to remember that pheromone therapy is species specific. So if you have a cat and dog diffuser in the same room, that is totally fine without issue, whether that's in your exam room in your hospital, if you don't have a feline specific, or if it's, again, for patients at home. And especially if you have clients that are concerned and really want to make pheromone therapy part of their daily life indefinitely, just remind them that the diffuser heads do need to be replaced every 6 months. So whether encourage that to either be on a refill timer or on a checklist. Matt, let's get a sense of how everybody's using these. I've been talking a lot about my personal experience, but I'm curious how our colleagues are doing.
Absolutely. We'll do our next polling question, which is about pheromone therapy. Let me go ahead and launch that. Do you use pheromone therapy in hospital, only at home, or both? I'm going to ask you a question while everybody's answering that, but I am going to let you know we're up to 34 different states, or 16
Love
missing.
it. Ooh,
I wonder if they're out there. So if there's anybody else that hasn't let us know where they're at, jump in there. Dr. Marks, while everybody's answering this, my guess would be, if it's working for a cat in the hospital, you would want to talk to that client then about ways that, if this pheromone therapy seems to be helping them in clinic, would you want to make sure to talk to them about using it at home as well?
Yeah, I think that sells itself. And often what I found is a client would come in, or a cat caregiver, and say, I cannot believe how calm my cat is here, right? I don't see this at home. And we'll start talking about pheromone therapy. And that is such a perfect segue, especially to say, tell me more about what you mean your cat's not calm, right? Maybe they're seeing multi-cat conflict. Maybe they're seeing a cat that's using displaced reactivity because they're watching outdoor cats and they can't get outside. Maybe the cat is having scratching in inappropriate places. It's a great kind of conversation starter, because that allows you to continue the care that they're seeing positive results at home. And so I think that's often where we fall short, is we're like, yeah, it's working great. And then we don't tell them about how that can be something that they can be empowered to continue at home, so they can continue that relaxation. I'd love to see how everybody thinks, though.
Before I give you that answer, Mary Beth wrote in, will feel-away spray have enough effect if I spray it on my clothing before feline appointments?
As long as it's 15 minutes before. Yes. And we often at our practice would spray our tops with Feel Away and then the bottoms with dog appeasing pheromone. So if you are in a mixed small animal practice, that's a way you can sort of make the best use of your body for this.
And then how often would you reapply?
So every 5 hours.
Every 5 hours. Okay.
As long as you're still seeing those appointments. Yep.
And here is our results. The biggest one is in hospital and as part of in-home with 62%.
Love it. Great. Yeah. So we kind of have a pretty mixed bag here. So I just want to show a few different studies. If you are already doing this at home, awesome. Like just kind of be like, yeah, I'm already ahead of the curve. But if you haven't tried some of the proactive use for home care and have pheromones as part of your behavioral plan, I just want to make sure you're aware of a couple different ways that have been really successful. So one is urine spraying. And if you look at some of the study, there's two of them that came out, one in 2001 and then one just at the end of 1997. They were taking cats that were urine spraying and using Feel Away Optimum diffuser in the home and use this over a period of 1 month. In 1 week, they were already seeing visible, and I mean statistically significant reduction of urine marks. But was really impressive of using Feel Away Optimum with these urine spraying cats is that within 1 month, 70% reduction of urine marks within the population of cats in this clinical trial and study. Half of these cats, though, had complete resolution. Now think about behavioral, we'll just say, abnormalities, even though many of them are not necessarily abnormal behavior, but clients think they are, like inappropriate scratching, right? Cats need to scratch. But think about how many of those cats are relinquished because of spraying or marking. And those are families, of course, that may have tried, quote unquote, everything, but maybe hadn't even been introduced to pheromone therapy. This could even save lives. So I really want people to be aware of that. The other is intercat conflict, which is a big problem, especially, of course, in multi-cat households, but even cats that have rescues or cats that are traveling, which we see a lot more of. Same thing with Feel Away Optimum, very similar study that Dr. DePorter did just a few years ago, looking at this over a month's time in these homes. Within 1 week, there was visible signs of a reduction of tension, again, statistically significant. But within 1 month, this is so powerful. 84% of cats were getting along better, even if the cats had been fighting for years. So last sort of soapbox statement about pheromones. If pheromones are sort of last on your list and they're your Hail Mary and you only bring them up when you have nothing else to offer with behavioral cases, open your mind, and maybe for 2024, pheromones become part of sort of top of mind. They not only stay in hospital, but they go home proactively. You're asking more about this intercat conflict. You're asking about behaviors at home that cat caregivers aren't sure are normal, or certainly are bothering or destroying and eroding that human-animal bond. These are things that should stay with you, and again, transition from hospital to home. Now, the next must-have that we have for feline professionals are the vertical spaces. And this may seem like one of the less immediately practical options. I get that, certainly looking at this room. But I promise to give you some solutions that don't take a lot of time, money, or resources. Remember, cats prefer to live in the vertical spaces. We know that's their comfort zone. So we need to really provide that when they come. And you can start small. So this is a table that was attached to chairs in our cat area of our lobby. And all we did was apply this little sign, right? Get the carriers off the ground. They want to be higher. Make a sign for your benches or end tables or bookshelves or even chairs that you designate in your lobby or exam rooms that direct the cat caregivers to place their carrier off the ground and elevated, because this small change can have a really big impact on their emotional health, because it provides them comfort and relief to not have to be next to dogs, to not to be on a vulnerable location, and certainly to get away from the space that they hate the most, which is the floor, right? We want them up high.
Dr. Marks, can I jump in real quick?
Sure.
I just want to share a couple of things that came into the chat. Michelle had something great. She said, we do all cat examinations in soft-sided baskets with heating bottles in them covered in blankets.
Love it.
The baskets twice a day with Feel Away.
I love that.
Rebecca and Denise both had something interesting. Rebecca says, I can tell when my diffusers are low because my cats, it sounds like at home, start having more tension. Love the Feel Away. And Carol says, No, wait, I'm sorry. Denise said, I was about to say, I noticed a little more than usual hissing and realized my diffuser was low.
Yeah. And I hear that a lot too from veterinary team members, but also from cat caregivers, especially ones that have gotten in the habit of continuous use. So again, remember if a client is in the exam room with you, and certainly I would love to be in a soft basket with heating bottles around. That sounds really comfortable. But if these clients are saying, wow, my cats are so calm here, what's your secret? That is the perfect introduction for you to just give that 30-second, very quick dissertation of what pheromones are and why this can be part of their home care too.
I have a really interesting comment here from
Sure.
Carol. She says, well, why can cats not be less stressed without pheromones? Like, do I have some sort of deficiency? And that's interesting because you think, oh, well, we need all these things for cats not to be stressed. It's really not necessarily about us and what we're doing, but situationally, right? Cats have to come to the vet, or even in the house, there's certain situational things that stress out our cat at some point during the day that we might not truly have any control over. So it's just trying to create a more calm environment to help combat those things.
Yeah, and I think cats don't necessarily have a deficiency per se, but we're finding out more and more of what's called epigenetics, right? Epigenetics is understanding what changes in our DNA code from generation to generation. And we know that this is a really hot topic in people, especially trauma survivors that have passed this on. Their children and their children's children actually have higher levels of anxiety and fear and higher sensitivities. And we know that, again, that's genetic. The same can be with cats. And remember, many of our cats are rescued, adopted. And as I mentioned before, the amygdala stores fear memories forever. So what we're trying to do is create a sensory experience at our hospitals that not only preserves that cat's emotional health, but gets that cat caregiver to see it's a positive experience so they come back, right? If you had a cat that was super relaxed and, just kind of sprawled out in the exam room and sucking down churu like it's going out of style without pheromones, great. Most of our cats, though, because faults of us in the veterinary profession and just what popular press has done, we've just done a very poor job of getting cats assimilated to hospitals, right, into veterinary visits. So pheromones are just a really great helper. And also, if you think about how much anxiety is in our world as humans and how much we do to try to relieve anxiety, pheromones are just a tool. They're not, again, if you're doing great at your hospital, you're not using pheromones, is it absolutely essential? Should you shut down your hospital? No, of course not. But every little tool helps. And we know more cats than not have stress. It's the number one stressor for a lot of them is leaving their home and coming to us. Let me keep going here with some of these options for vertical spaces. So a great, interesting journal article that came out of Applied Animal Behavioral Science back in 2016 was looking at some of these group house cats and really what can happen when we use different logistics to create positive associations. And here's some of the things they found is that when cats are able to have these vertical spaces to explore at homes, even if they're just using shelving units or these wall hangs, cats were incredibly enriched and also had statistically significant reductions in their anxiety. So we're looking at two really positive things, right? Positive from the enrichment means we're doing positive stimulation to the brain, but also reducing those negative emotions of fear, anxiety, and stress. So think about ways in your exam rooms. What could you do? Can you add a shelf? Can you add a cat tree? Can you add a climbing wall, right? Can you add even things that just have a shelf with some type of non-slip surface on this? I love this cat because I'm like, this cat is in the exam room like, yeah, this is my space. I'm here. I got it. I love this picture. These are things that, again, depending on your time, money, resources, and space, you can create at home. Here's a super easy thing that you can add that's $20 on Amazon. We've actually used this in certain spaces in our hospital. I know colleagues who have used this. All you have to do, again, is buy this and screw it in, right? Make sure you got some anchors, but screw it in. And then these cats can climb this at your hospital. You could even do an exam if they choose, again, choice and control, if they choose these steps or rungs. Now, certainly one of the keys to this is to not place it so high, right? I'm 5'2", so I would not be placing this near the top of my wall where I'm climbing to try to get them down, but high enough where they, again, are off the ground. So for me, that's eye level, where I can comfortably work with them if they choose to be up there. When you're ready, and after you've tackled your lobby and exam rooms, you need to also consider how vertical spaces can be implemented into your hospitalized areas. Now, brand new condos may be on your 2024 wish list, right? And it may be on the horizon as an investment. And certainly there's tons out there that are really, really positively designed for cats. But what about just thinking about this? What about adding in a traditional carrier and just turning it upside down, right? It has a dual action. Not only can they sit on top of it as a vertical space, but they can go inside as a hiding space when necessary. So this could be your donated carriers that, again, just take them apart, take that bottom, turn it upside down, and you've got dual action for those hospitalized patients. Now, I said hiding spaces. That segues into our next one on the list, of course. And I really, before I go too deep into this, I want to survey, Matt, kind of what people think about for the necessity of a hiding space. Is it just nice, or is that a must-have for everybody out there?
All right, well, let's launch this. What do you do to give hospitalized cats for a hiding space? Is it a towel, a cardboard box, a tunnel, a carrier bottom, or other? And Dr. Marks, you tell us, is it important that every cat have some sort of hiding space, or do some cats not need one?
Well, I'm a must-have on this one. I'm going to say every cat does, but I'm curious to see if people are using other, we'll just say, creative ways. I've had colleagues say to me, well, I just throw a towel in there. I'm cool with that, right? A lot of cats really love to just bury into a towel, especially if it's been warmed or has pheromone spray on top of it. Cardboard boxes that you get your inventory in, great options, right? There's lots of tunnels. I showed the carrier bottom. But if you've got this really creative hiding space that you're using, please share it with us in the chat. I love to have other options for people, especially if they're economical or there's something that, wow, this is a new use, right? So we can be sustainable and good for the environment too. Let's hear how everybody's thinking.
Well, Emily says we do cat houses or their own carriers that smell like home. There's a plus there. Donna says we implemented the upside down carrier quite often. It definitely has made them more comfortable.
Awesome.
And the biggest vote getter so far is a towel. 51% of everybody is saying towels are what they use. Tunnel is getting the least, which I would imagine, especially in enclosed spaces, tunnels are maybe better for bigger places.
Yeah.
Jody says we use Rubbermaid totes with a hole cut into it.
Great idea.
Says a nice cat bed, usually with fleece, or we have a plastic tin that we cut out and it fits bed fleece, especially for our borders.
Great.
Carol says we sometimes put a towel over one of the two doors, towels over the cage. We use fabric tents made as cat beds. Sarah says sometimes our hospitalized cats donut in the towels in the back of the kennel. They sleep lounging every time.
Yeah.
Megan says small plastic stools like in the picture work well to give them a hiding spot underneath.
Great idea.
On top. Stephanie, we live their own cat carrier in them with when possible. Otherwise, we use towels. Mary Beth says we use 2 litter boxes, one with towels for hiding in and the other with litter.
All great options. I'm loving this. Thank you so much for sharing what works for you and your pearls. Really like this. As we kind of go through this, again, I there's some things that I take a huge stand on, right? Like no more scruffing. But the other one I think is really this. Hiding is a must for choice and control. I keep coming back to that phrase, but that's really what cats need. And that's what they desire in all aspects of life, not just in our hospitals. Hiding has to be something that our feline patients can choose because it's a coping strategy for them for negative emotions, especially when they're in an unfamiliar environment like our hospital. So offering them any of these options or a high-sided igloo bed, or like I said, just a thick towel, it gives them security, the sense of control, and this really, really critical, especially for our hospitalized patients that are cachectic, that are in need of, that are immune suppressed, that are in need of healing, need of sleep. Our geriatrics, our pediatrics, they absolutely need this. And it is part of the healing process. So I'm happy to hear that everybody is on board with these. Now, another study that sort of was helping us solidify this feeling was, again, this finding that the cats in this study were provided with a hiding box, and they were able, statistically significant, data, able to recover faster in their new environment that they were shown compared to cats that did not have a hiding box. So it's really an important and essential enrichment tool for cats to cope effectively with stressors, especially if they're going into a new environment, like a new home, or they're coming from a shelter, or they're coming to the veterinary practice for the first time. When we provide a safe space for cats to hide, it increases, again, the coping ability. And certainly as we think about the 5 pillars of a veterinary practice, you see pillar number 1 is to provide a safe place. That's not just for us, that's also for home, right? But we're increasingly aware of the need of these 5 pillars to create that sensation of safety for cats. And we know that when cats feel safe, they can rest. And resting, of course, is critical to cats, just like it is to people. Now, another emotion, frustration, that we often see in cats, I want to just point out to you, and that's this. So many of us will have cats that are hospitalized or boarding or here for procedures that sort of claw through, and I've been just as guilty. I walk by and I'm like, oh, this cute kitten that's here today, and kind of tap or touch them and then move on. The cats that are doing this do not feel safe, right? They are looking for something because they either haven't found the safety within that hospitalized setting itself, or they are not receiving this anticipated reward. So they have, and again, that's usually in the form of attention, but this is a frustrated cat. So if you see hospitalized boarding cats or cats that are there for workups that are pawing at the cage bars, tearing up towels, tipping their food and water, destroying their litter boxes, that is a cat that is frustrated, bored, and doesn't feel safe. So take a few minutes, don't just play with them. Take a few minutes and assess, how can I change this immediate environment? Give them a hiding space, give them a vertical space, give them toys, give them something to enrich, because again, it is a sign of frustration. So here's some easy things, again, really reasonable, that you can think about adding in addition to all these great suggestions our colleagues are sharing. Sure, many of you are probably familiar with the Desi and Rue Hide and Sneak. This was something I tested out long ago. It's been on the market for a long time, but definitely something that's easy to have, collapses down and stores really well. And this is great especially for cats that might be boarding for a while, or if you've got a kidney cat that's going to be there all week, or something, again, where you're going to have a cat that's going to be there for an extended period of time. Here's another thought for longer term patients or those being hospitalized. I like this because it has the dual action of hiding and enrichment too. But the added plus here is that sisal scratching surface. And we know that is a preferred texture for cats. Don't forget, scratching is totally normal for cats. It has 4 functions. It has exercise, releasing old nails, obviously a stress reliever, and as we talked about, those interdigital pheromones, marking. So we do know that cats prefer to scratch associated with their resting areas. So really, really critical to think about that. This is, like I said, sort of that all-in-one option that I really like. And just for fun, I really love this option from Etsy for an exam room wall, right? Because we all have the ability to provide a vertical space. And what this does is not only allows them to be higher up, it allows them a place to rest. It allows them the ability to survey the environment. It even has that easy hole where we could examine the cat if they preferred to be in there, as this is again, with choice and control, this is their chosen location. So I really like this as an option as well. And again, pretty reasonable to add to any exam room. And then finally, again, even if your budget is less than that, even if you're saying I've got $20, right, to add these, this is an easy cat kennel that is a great hiding space. It's washable, it's collapsible, it's easily movable. It can be brought in and out of exam rooms for kittens to play with during the exams. There's a lot of options here. So again, think creatively and out of the box. There's great ways that we can add enrichment, but also resting and hiding all in one.
Dr. Marks, really quick, before we move on a little bit, I want to have you, and I know we're starting to run out of time. A quick question here, though, from Wendy that I think could be really important. Any suggestions for pop-up vaccine clinics in low-income areas? I volunteer at a few, normally at a church or church parking lot. Vets and techs are all volunteers. All exams and vaccines are free. We've helped over 200 plus families and their cats and dogs, but the animals are usually very stressed. Lots of barking dogs. Some cats are too stressed for us to handle. If they are intact, we have them schedule a spay-neuter appointment and do the vaccine then. Any suggestions when you have limited control of the environment?
Yeah. And, first of all, thank you for what you're doing. it's hard, right? There's not going to be some magic answer. And I'm sure that can probably be frustrating for you as well, because it sounds like you want to do more. So I think there's some probably reasonable actions that you could take and talk to your clinic and see if these could help. So one is, can you do the cats on a separate area of the parking lot? Can they be completely separated from the dogs? Can you set up a table opposite ends so that they don't even see, hopefully barely hear the dogs? That will be one easy thing. Hopefully that can happen. Two, pheromone impregnated towels on everything, on your tables, over the carriers. As soon as these people arrive, the carrier gets a towel on top of it. You have pheromones all over yourself. You have them, like I said, on the table. You use the towel for restraint. If you could play music, and we're talking about the sensory experience, that would be the next thing. So can you have a speaker under a tent to calm these cats? Can you provide a positive treat? Is there any budget to get churu sticks that you can have? Those obviously the kind of the tubes, right? Can you have churu available for these cats when they come? Please, I would love to do a whole hour on this, but please reach out to me. I'll leave my email at the end. I know we don't have a ton of time to cover this. I'm happy to help strategize for you as well. Matt.
Perfect. Let's launch this fourth poll. What's your favorite music to play in the exam room for a positive sensory experience? Is it classical, reggae, cat-specific music, some white noise? What do you do there when you have some music in the exam room? Dr. Marks, is it important, like how important is the cat's auditory experience compared to their other senses?
Yeah, so remember that a cat's sense of smell and hearing are their two most powerful and acute senses, as opposed to taste and sight. So we know that cats have such amazing hearing, they can hear the ultrasonic chatter of rodents. So if we aren't sensitive to that, no pun intended, and don't think about how we're conducting ourselves in the exam room. Do we have loud pages coming through on the phones? Is there alarms going off from pumps that they can hear all night long? Are there really loud lab machines? Is our centrifuge constantly out of balance and making loud noises? Are we shushing or being loud ourselves in the exam room? These can be very negative for cats, especially shushing, which cats hear as hissing. So think about those things, but I'm curious to hear what everybody's using, because this might be an interesting one.
Almost 50% are saying classical, cat specific 25%, white noise 20%. Your favorite reggae is only marching at 7%.
Oh no, nobody's playing Bob Marley.
No.
Oh, well, I'm happy to hear that so many of you are at least playing music, right? Because we know how critical that sensory experience is. Here's a couple thoughts. We know that cats have, like I said, that tremendous hearing capability. I noticed that some of you may even be using through a cat's ear. This is probably
a number have said.
Awesome. So this was sort of that foundational piece that we had to use. But we also know from studies that not just classical, but reggae music is a favorite of cats. So if you're getting sick of this playlist, think about soft reggae. It's really powerful for cats. It doesn't just create, though, that positive association for the cat and the caregiver, but remember, it's also positive for our team. When we have that calming music, our senses are also calmed and muted. And that's very important, right? Because if we're anxious, but a cat's relaxed, they will pick up on our anxiety very quickly.
You know, Emily wrote, we play bird sounds, and it really seems to engage the cats and makes them want to explore the exam room. That's pretty interesting.
Yeah. So I think that's great for cats that are already approached in your exam room in a positive way. I would love, Emily, if you can reach out to me afterwards. Have you tried it with cats that are already at an escalated level of stress? Because I wonder, does that heighten their stress or does it calm them down? So I would love to hear that if you don't mind reaching out. This study was also really interesting too. And I think this is partially where some of you were talking about the cat specific music. Some of you might be like, what is cat specific music, right? This is, they had cat specific music was developed with these melodic lines that very closely associated with the vocalizations and rewarding sounds that cats use to communicate to each other. So they're interpreted as more likely to be effective if the goal is to calm an agitated cat versus to to kind of keep a cat who's already calm. So they did some of these studies looking at music therapy to reduce stress in hospitalized cats, and this was just recently done in 21. And there was some benefit certainly to cat-specific music and classical music, again, in that healing process. If you're interested, I don't know if anybody has referenced this, but this is a very, very popular playlist, an example of cat-specific music. And certainly if you're interested, this is the YouTube link, and reach out to me. I'm happy to send this to you.
A couple of people did mention that one as you.
Awesome. So if you haven't listened to this, this music has purrs and sucking sounds that are made to sound like real cats. The frequency are similar to cat vocal ranges. And remember, that frequency is 2 octaves higher than the common human vocal ranges, which is like 55 to 200 hertz. And it's found statistically significant to be pleasing to cats. So really good to think about. Now, our next essential is food for thought. Usually for me, that's the first thing I think about. We're obviously not talking about broccoli and pears and asparagus, right? But I think one of the big misconceptions is that cats only want tuna in the exam room. So I'm here to disprove that. Here's a list of tons of cat-approved treats for you. Cats that are relaxed will eat, especially if we encourage our cat caregivers to bring them in fasted, right? So churu is everybody's favorite, I think, on this list. But don't forget that cats love marshmallows, and they love green olives. They love whipped cream. They love Doritos. They love easy cheese with bacon. There's so many things you can try. Get creative, and certainly think about what is going to be kind of the hit list of your hospital. Many hospitals will even provide a menu ahead of time and ask a cat caregiver what their cat prefers that day, and make note of it, right? Because it's really important to make sure that we keep that in mind. The next, of course, and this is a big chunk I need to spend some time on. I know we're kind of getting out of time, but I need to make a big point here, is passive restraint. And I can't say that enough. Passive restraint is the way of the future, and really the goal of training at every veterinary hospital, because what is not the goal is immobilization. And I need to just share this study quickly, because this was a pivotal moment in how we thought differently around restraint. Okay, so this study was done by Moody's group. It was at a shelter, and the reason they did this is because we know with immobilized cats, we were seeing a lot of negative emotion. We want cats to be able to feel a sense of control, not experience fear and frustration and pain, because that's what leads to aggression and repulsion. So in this study, and you can see this very grainy picture because it's from a super old textbook, and hopefully that's how we're going to think about full body restraint. Way back when, this is when we did it, right? But when they looked at cats that were, again, in shelters, when they were restrained full body, meaning they had obviously all limbs restrained, the head is restrained, and they were either stretched or at least butted up against the body, cats that had full body restraint were 8.2 times more likely to struggle. 8.2 times more likely. And those that were restrained full body, it took twice as long for them to perform exams. So if we think about efficiencies, right? The final thing is that how many of you are doing exams on exam tables, and all of a sudden you get done and that cat goes and jumps off and runs away? Many of us just sort of blow that off. That is escapism. That is not our goal. The ultimate goal is for that cat to choose to stay with you. There is a greater likelihood that the cats will want to escape when we use full body restraint. So we also know that full body restraint, and I can't even look at this picture, right? Stretching and scrubbing. We know that there were negative physical consequences that were measured, like increased respiratory rate, pupil dilation, vocalization, lots of lip licking, all of those stressed ear positions, right? To the side, back, flat, all of those. And that is, of course, negative as well. So think about this next time when you are doing anything, right? Vaccines, physical exam, blood draw, blood pressure, cystocentesis. How can we think about parasternal passive restraint? How can we think about ways to utilize our towels and other tools to make these cats have a little bit of choice and control? Can they move their head? Can they look around? But again, we want them not to have that escapism and want to go away. We want them to have that relaxed body posture, none of these escalated physiologic parameters that we're measuring, but the ability, again, to be comfortably and safely with us through the experience. Now we're almost there. Second to last is the venipuncture toolkit. I think this is a must for every feline professional, whether you're using a plastic shower caddy or a tool caddy or whatever is the easiest thing to have everything handy and efficient. Just real quick to survey, I would love, Matt, for you to kind of get a sense on what everybody needs, especially for needle phobic patients.
So what do you do differently for your needle phobic patients? EMLA cream, quiet clippers, small needle gauges, or all of the above? And Dr. Marks, real quick while everybody's answering, do you just assume every cat is needle phobic? Do you like take precautionary measures, or is there a way to gauge that?
So I think there's two things to answer to that. One is certainly if you have a previous history with that cat, hopefully it's been documented in the medical record and you're taking good note, right? And you're being proactive. My feeling is this: if we have a cat that is showing complete relaxation, right? No anxiety, no stress body language, they're relaxed and comfy in that towel or that really warm basket. I don't think we need to use everything in our toolkit for that. However, I always use at least one. And so I'm curious to see if it's the one everybody's doing.
Well, if it's the cream, it is not the one everybody's doing. Most people are trying to use small needle gauges, 60%.
Good. Is anyone using EMLA cream or quiet clippers?
2%.
All right. So let's
16% with the clippers.
Interesting.
And all of the above 21%.
Oh, great. Okay. So we got a wide range. So that's good. Hopefully this will be some things we can take back, right? So if you aren't familiar with EMLA cream, one of the big ones that this is available and really awesome to use is, again, a topical lidocaine cream, right? That you can use. And just like pheromones, it's easy to remember. They both need about 15 minutes of contact time. However, I will say anecdotally, I feel like after 5 minutes, my cats actually feel much better. But if you have a known needle phobic patient, I would be putting this on as soon as you get in the exam room and letting it sit while you do a history, let the cat explore, get some high reward treat, whatever that might be, so that when you're ready for a diagnostic, it's there. It's certainly something that we use for all catheter placements. It's something that you can be using for getting biopsy sites ready, whatever that might be. But I think that's something to definitely keep in mind and keep in your toolkit, especially for intravenous catheter placement. The other part of this toolkit for me is to remember that rubbing alcohol is a no-no for cats. We want to use diluted chlorhexidine. Rubbing alcohol can create significant nose blindness. It actually can, when these cats are exposed to it, especially if you're dousing cats for a jugular stick, they actually will have destruction of their olfactory cells, leaving them nose blind for up to a week. It takes about a week for those cells to regenerate. And then we have a really, really uncomfortable cat that can be more anxious because they have one sense down. So diluted chlorhexidine is really, really helpful. Another alternative to that, it can be witch hazel as well, if any of you are using that. But we definitely don't want to be using rubbing alcohol as our primary pre-draw agent. And then finally, I know so many of you recommended low gauge needles. Keep in mind that's not just for blood draws. Obviously, it's also for vaccinations and injections. Really, really critical to make sure we have that. And then if you don't have access to a quiet clipper, this is one I've used in the past and I've been really happy with. Has a lot of different gauges and sizes depending on what size of cat and the location you're clipping. So this is a really nice option as well, especially if you need something that you can move from room to room really easily. And then finally, our last thing, of course, is we've done all of this wonderful work to get our cats to us safely and relax, to make sure our exam room and our lobby and our interactions with our cats have the most positive sensory experience, and also, again, that passive restraint. But we need to keep communicating with our cat clients, because if we don't, we might not see them for several months to years, which obviously can happen. So I know many of you are using Catterday on your social media, but I just wanted to do a really quick review on the different platforms and which is really best for veterinary practices, because many people say, do I need to use all of them? And certainly no, you don't need to use all of them, but let's see what's going to work best, right? So for me, Twitter is probably my least used, just because it takes a lot of time to manage, and most people today don't necessarily have that. But if you have someone who is really, really skilled and acute to this, I think this is a wonderful way to draw a big following, because you can be tweeting out quite a bit, but it can result in those loyal leads. Now, Facebook, of course, is the #1 social media recommendation still for veterinary practices, although TikTok is certainly climbing quickly, because it's just a very, very commonly used way to build community and share content. Most importantly, though, show what's different about your practice. Show what a cat exam looks like. Show what you've done to create enrichment in the room. Show what you're doing to have that really positive sensory experience, not just for that patient, but also for the cat caregiver as well. And then Instagram is a really great way, I think, to obviously for imagery, but it's a really positive way to show, again, what's different in a quick snapshot, right? What is a pheromone diffuser? Why do I have this in the exam room? Why am I using towels? Why am I picking this quiet clipper? Why are we in a shush-free zone, right? All of these things, because that intrigues these cat clients to want to come back, to want to be, again, in a clinic that focuses on cats' needs. And then finally, if you're not using Pinterest, I know Pinterest is making a comeback, right? So this is a great place to make cat-specific boards, especially for clients that start to engage. So this would, again, not be my first choice, especially if you're short-staffed and low on time. But if you're really interested in 2024 to say, I want to do something different, Pinterest can definitely be there, especially for millennials and Gen Zs who really are starting to prefer this platform. Now, I know we've covered a ton today, this webinar, and I know there's been a lot of great engagement and tons of feedback and probably more questions that we haven't gotten to. Matt, I'm certainly going to stick around as long as we can to answer some of those. But here is my direct email. Please feel free to reach out to me for the deck, for questions. If there's something that I talked about, you want more clarification or a deeper dive, be happy to get back to you. We want everyone to feel supported. Certainly, I've been so grateful for all this, the attention and interest tonight, and certainly hope that this can be a practical way to get you your must-haves going into 2024.